Good morning. I'm going to talk about male uh, breast reduction. Gynecomastia is the term, and gynecomastia resection or male breast reduction is the surgery. Um, it's probably one of the most common surgeries that I do in men and has been increasing over the number of years. Questions that I'll ask the patient when they come in are, what age did it start? Quite often, a lot of men will say it started around puberty and thereafter, um, leading to a source of embarrassment. Of course, we don't operate at that age because the majority will have it resolved to a degree with the hormones surge decreasing. But a significant number, it doesn't go away and is a source of bullying, teasing, embarrassment, even if it's minor, into their adult years. Of course, it's more common as your weight is higher, but not directly proportional. There are questions that I have to ask the patient to make certain there isn't a cause that needs to be addressed. Um, Taking steroids will lead to this, and of course, they should be stopped. We also need to know that for the safety with anesthesia. Excess marijuana use has been associated with male breast development as well. And lastly, we want to make sure there's not been any testicular masses felt because that would necessitate a workup. Um, I believe there's 3 degrees of classification that determine which treatment to do. Um, the first degree is the more mild degree, and those it's usually there's no skin sag, there's a breast that's larger than normal and bothersome to the patient. Those I'll address through a combination of first liposuction, using an incision near the armpit that's hidden and one a little lower down that can look like a mole was excised. Um, but then at the end, we have to do an incision to remove breast gland. In the younger patients, they will have a firm gland that's just below the nipple or areola. Um, the the This is too firm and too hard to be liposuctioned and removed in the younger patients. Some of the older patients, though, I can just do liposuction alone. And then there are a few younger patients that don't really have any fat, just that breast bud. And those are the rare cases we can sometimes do under local as a very minor case with some oral sedation. The liposuction is done with fluid infused. That fluid makes it safe with less blood loss, but also keeps us from seeing the final result. So there can be sometimes need to resect some more tissue that couldn't be felt or seen at the end of the operation. Even though we palpate and feel it, you're doing it through a tiny incision around the areola from 3 to 9 o'clock. The third degree I'll discuss next, and that's the most advanced degree where anyone would say that male has breasts. There can be sag of the breast, they can be quite large. Those cases are essentially treated like the female breast reduction and require skin scars, an anchor-shaped scar or inverted T-shaped scar and around the areola. And those, we get a much smaller breast. They'll look much better in a tight T-shirt, but it still may be bothersome to remove their shirt because the scars are quite noticeable and obvious. But that's the only way to remove the extra skin. So it's very similar to a female breast reduction. The most difficult one is the one in the middle, where some people have some degree of skin sag, a larger breast, and there's the debate on what to do. To make it the tightest and smoothest requires skin excision, but then skin excision results in bigger, more visible scars. Since the whole point for a lot of men is to be able to remove their t-shirt and not feel embarrassed, adding the scars is detrimental. In this group, I tell them, I can't predict how much your skin's going to shrink. If your skin's going to shrink really well, you'll be very, very happy. If your skin doesn't shrink well, you'll say, well, I still have some extra tissue, usually in the inferior lateral quadrant. If they want later, we can always resect some additional skin. It's my personal preference to tell them not to excise the skin right off because you can't undo a scar later. We can always cut more skin later if the person feels there's still too much. I feel 90% of the male patients are happy with this approach. I've had a couple decide later they want to excise more skin on the side and then are happy with the scar. But at least they get to choose that. That can usually be done under local at minimal cost too. So those are the different treatments. We can do everything from just excision of a small breast bud under local to needing to do almost a full breast reduction like in females. So there's a whole different range of amounts and types of surgery depending on how much the person has. The risks. You have to plan on permanent nipple numbness. The nerves to the nipple are cut. You may get some protective sensation over time, but a lot of sensation is probably gone forever. You have to plan that there may be asymmetry and we need to do a touch-up or revision. We're doing this swollen and blind. In fact, I tell the patients the first week, you'll swear I didn't do any surgery because with the swelling after surgery, you'll look about the same. There's bleeding is higher in this case because we're doing it blind. So it's about a 3 to 4% chance of hematoma or blood clot in the chest. That's not dangerous. It just means we have to go back to surgery, rinse it out, and close it. You have to plan on a risk that the nipple could die. Now, in a non-smoker, it's probably only 1 or 2%, but in anybody who uses nicotine, it could be catastrophic with the nipple turning black, entirely rotting and falling off. You absolutely cannot use any nicotine in any form, whether patches, whether chewing tobacco, whether cigarettes, whether vaping. None of them can be done for 2 months before and 2 months after the surgery. The recovery. The recovery is usually pretty easy. Most people are so motivated that they're happy. It's done as an outpatient surgery. We do it in our office accredited, Joint Commission accredited facility here. They go home the same day. It's no weightlifting for about 6 weeks, but you can do walking, you can do moderate use on an exercise bicycle. The chest is usually wrapped up for a few days. Then you wear a compressive garment. Usually I have people buy a very tight Under Armour shirt for another month or so. People usually only miss a few days of work. Satisfaction is high, although this is the one operation where the surgeons are higher satisfaction than the patients in recent studies. Maybe because the patients really believe they're going to be sculpted to look like a male supermodel, but that's not the case. All we can do is hope how well your own skin shrinks up and contracts. We don't have the ability to sculpt people perfectly. Of course, their rib cage and their pectoralis muscle underneath also still are there that we don't affect. But by and large, people are very happy. They can go to taking their shirt off. The scars usually fade over 6 months, and they're back at all activity by about 6 to 8 weeks. So that's one of my more common male breast surgeries on male breast reduction. And thank you for listening.